The European Code Against Cancer represents one of the most comprehensive, evidence-based frameworks for cancer prevention available to the public. Developed by experts from the International Agency for Research on Cancer, IARC, in collaboration with the European Commission, the code distills decades of research into 12 practical recommendations. Though rooted in science, these guidelines are often overshadowed by louder, more sensational claims circulating in wellness culture. Yet they remain some of the most powerful, low-cost tools for reducing cancer risk, not just across Europe, but globally. At the core of the code is a sobering message. Many cancers are preventable, but only if people can cut through the noise of fad diets, misinformation, and commercial distraction. The code's strength lies in its simplicity and scope. It doesn't offer magic bullets or trendy shortcuts. Instead, it calls for consistent changes in behavior that, over time, have a measurable impact on cancer incidence. These include not smoking, maintaining a healthy body weight, being physically active, eating a healthy diet, limiting alcohol, and avoiding excessive sun exposure. Other guidelines focus on workplace protections, environmental carcinogens, vaccinations, especially for HPV and hepatitis B, and participation in organized screening programs. The recommendations reflect consensus, not controversy, but in an era of information overload, consensus is often ignored in favor of louder voices with profit motives. One of the most consistently underestimated components of the code is weight control. Excess body fat is now a well-established risk factor for at least 13 types of cancer, including breast, colorectal, liver, pancreas, and endometrial cancers. Obesity contributes to chronic inflammation, hormonal imbalances, and insulin resistance, all of which create a pro-cancer environment in the body. Despite this, weight loss remains framed largely as an aesthetic goal, not a medical imperative, and the toxic culture around dieting often leads to cycles of unsustainable restriction followed by relapse. The code reframes the issue as a matter of long-term cancer prevention, not just short-term wellness. Alcohol moderation is another recommendation often distorted or dismissed by the public. The code is clear: if you drink at all, limit your intake. For cancer prevention, the safest level of alcohol is none. Even moderate consumption increases the risk of breast, colorectal, liver, and oropharyngeal cancers. Yet the cultural normalization of alcohol, especially in social and professional settings, makes this guidance difficult to follow. Moreover, the alcohol industry continues to fund studies and campaigns that obscure or minimize the link between drinking and cancer, further complicating efforts to implement public health policy around this issue. Diet, too, plays a central role in the code. It recommends a diet rich in whole grains, vegetables, fruit, and legumes, while limiting high-calorie foods, red and processed meats, and sugary drinks. These recommendations may sound familiar, but they are often drowned out by the competing noise of anti-cancer foods, celebrity detoxes, and pseudoscientific diet plans. The code emphasizes dietary patterns over individual nutrients or superfoods, and that nuance is often lost in translation. In practice, this means that no supplement or exotic berry can undo the damage caused by a diet dominated by ultra-processed foods and excessive animal fats. Unfortunately, much of the wellness industry thrives by promising otherwise. Physical activity is also strongly promoted, not just for weight management, but as an independent factor in reducing cancer risk. Regular movement helps regulate hormone levels, improve immune function, and reduce inflammation. Yet modern life increasingly encourages sedentary behavior, and many people struggle to meet even the minimum activity thresholds. The code urges a culture shift toward integrating movement into daily routines, not relying solely on gym memberships or weekend workouts. However, without supportive infrastructure, safe, walkable neighborhoods, affordable sports facilities, or flexible work environments, these goals remain out of reach for many. Perhaps most critically, the code underscores the importance of organized screening and vaccination programs, especially for cervical, breast, and colorectal cancers. These interventions can detect precancerous changes early or prevent cancer altogether, as in the case of HPV vaccination. However, vaccine hesitancy, mistrust in healthcare systems, and political misinformation have created resistance to even the most effective preventive tools. And in marginalized communities, access to screening and follow-up care remains uneven, creating persistent disparities in outcomes. Despite its strong scientific foundation, the European Code Against Cancer faces an uphill battle in reaching the public. Its recommendations are often too quiet, too humble, or too rational to compete with the commercialized spectacle of diet books, biohacking influencers, or miracle cures. This is not just a communications problem, it's a societal failure to prioritize prevention over profit, population health over personal branding. Until public health messages are amplified with the same force as pseudoscience, millions will continue to ignore or misunderstand the advice that could save their lives. In essence, the code is not revolutionary, it's a reminder. A reminder that the most effective cancer prevention strategies are well-known, well-studied, and widely ignored. They require no app subscription, no exotic ingredients, and no DNA test. But they do require honesty, discipline, and collective support. Cancer risk is not entirely within our control, but a significant portion of it is, and the European Code Against Cancer offers a roadmap that too few are following.